because of the geographical, topographical condition of our region and of our state. The population may be less, but there are a lot of challenges in many sectors, and particularly the health sector. And COVID was like a blessing in disguise for all of us. And I was fortunate to be a part of the COVID wearer, where I was given the responsibility by the state government and both in first as well as second wave of COVID. And particularly during the second wave, I can still remember how people rush from one hospital to other in search of ICU beds, in search of oxygen. So we have learned a lot, and as I've stated, the well-meaning and the bright people, we are grateful to Mr. Vinod, we are grateful to Mr. Sirkan, who have involved and we have decided to help our people. We are grateful to you, and we hope that this is not going to be the end. This is just a beginning of our mission. And I would also like to appeal all our people that those were the days the serious patient used to rush all the way from the district of Kipri, district of Tangsang, Moon, Naklak, Zinepoto, so on and so forth, to the district of Kohima and Dimapur in search of ICU facilities, in search of an oxygen. This is not going to be the same anymore. And I stated by January this month, all the 10-bed ICU in throughout the land and breadth of the state, in all the district hospital, will be functioning. And we also have a plan to give the awareness campaign as well as the training. Motivation will be taken up in all the required manpower will be placed in the district. They will be trained, the nurses and the doctor will be trained. Not only that, there is going to be a communication. The hub is going to be at Naga Hospital, Kohima, and now and then the doctors in Kohima will be discussing, interfacing with all the district hospitals in case of any kind of clarification, or doctors who are well qualified will be there, and they will be guiding the district ICU manpower to in case of any confusion, in case of any requirement. So you see, the technology is such that in no time we are going to interface each other. So it is going to be a good news for the state, as well as, most importantly, for all the district, and particularly our people living in the rural areas. So things are not going to be the same again. And as we know that the state has tackled the first wave and second wave of the pandemic so well, in spite of limited infrastructure. So should there be any third wave also, I believe the state and the Department of Health and Medical Welfare, we are prepared to encounter any eventuality. And because of all these things, we are mentally prepared. And that's how we are working around the clock. We are working 24/7. And I would like to once again thank the donor, as well as people who are behind, and people who are still struggling or trying to set up all the infrastructure in the district hospital. The official luncheon will be done on 6th of January by our Honorable Chief Minister in presence of our Honorable Medical Minister. But today, the 3rd of January, I would like to bring to the kind notice of our people that the luncheon of 10-bed ICU is going to be the best New Year gift to our people.